Good afternoon. My name's Olivia. I'm known as Olivia K on Facebook, Ollie K on Instagram, and Warmium9000 on Reddit. I talk about nursing related materials that can help you for your next attempt with the NCLEX, whether it's the RN NCLEX or the PN NCLEX, and help you through ATI, which most of you guys use in nursing school. So I have like a playlist for the fundamentals, which I'm going to plan to redo videos probably after I'm done with the pregnancy lectures. And then what else? I have pharmacology videos of like your high yield ones that I know they will probably ask for in the NCLEX. So I do have a playlist of that, and I may do some shorts of some not high yield, but like need to know meds that you may see in on a QBank or something like ATI. So I'll have some of them sporadically. And then I also have just finished the MedSearch content that's comparing the two different diagnoses. And I actually might look into doing some respiratory high yield stuff because I did leave some things out that I think would be potentially helpful during, again, the NCLEX. And even, again, QBanks like UWorld or boot camp and etc. So I also cover reality TV shows. I know I kept promising Ultimatum. It will come. I'm sorry. I haven't watched it yet. I'll probably watch it after I'm done making these videos. I'm so sorry. I do have reality TV show reactions. I have a playlist of The Love's Blind if you get bored of my nursing related materials. I also cover documentaries, and I have a whole playlist of that too. So this Friday, I believe, is just an opinionated piece. Not so much just random, because I didn't get to look and do the ultimatum, but I will rewatch it again, I promise. Okay, but I do have a playlist and then opinion pieces, so it's there if you need it. And you have any more suggestions of what I should cover, I will. I actually watched House of Dragon season 3, and I did enjoy it, so maybe that's something I should talk about. Like, maybe go over that, because I know a lot of people love to watch that. So we'll see. But today we're going to talk about get into pregnancy. I'm only just going to go over the signs of it, because before we want to really get into the nitty gritty of it, it's good to start off with the basics. And personally, I like to do maternity newborn because I had a hard time with maternity newborn in nursing school, and I know they ask a lot of maternity stuff with the RN and NCLEX exclusively. But I know PN people, the PN students may get some questions on it, but not a lot. But maternity is very important for RN, because depending on where you choose to work at, it's important. Depending if it's like, say, med surge or ICU or whatever the case, it's good for you to have that understanding, because you will deal with a pregnant patient and you want to have some basic understandings and what to look for. Like, it's the most fundamental piece of pregnancy you should know. I'm not going to get into it because I don't even work in maternity myself. I do work in a methadone clinic, which that's actually the video I'm going to do. And I know I've gone over it already, but I'm going to just go through it anyways. And I do have like a few pregnant patients there, and it's just so lovely to see and just see the progress and whatnot. So, well, that's not even the point, but yeah, I will talk about pregnancy today and just go through it. So if most of you will find this piece of information today that I'm going to cover basics. So I'm going to get to that, and then next week we'll do the get POW and how to calculate the nursing pregnancy. Okay, so that's the next basic part to know. Okay, so signs of pregnancy. There are 3 types that the nurse should be aware of, right? So there's presumptive, which is very common with most people who are like, oh, I might be pregnant because of this sign or that sign, and you don't know. The thing is, it's not definite, right? Then you have probable, because you may have these signs, but it could lead to, it may be pregnant, may not be. So that's another difference. It could suggest it, right? Then you have positive, because it's definite. There's no ifs, ands, or buts. That is that sign of pregnancy. Okay, so I'll really get into it. So I talked about presumptive, where it's more so subjective. So that's the difference between presumptive and probable. It's subjective. The woman's feeling it. And it could be because they missed a period. Because see, that's the most common universal sign, because they're thinking, oh, I haven't had my period in this day, I could be pregnant. But you can miss periods for different reasons, right? Then nausea and vomiting. A lot of things can make someone nauseous and they can vomit. For instance, I work in a methadone clinic, and I have patients that vomit because they didn't eat something, or the medication's too overwhelming for them, or they're just feeling off. These are recovering addicts. So it could be happening. Fatigue, that's general. That's, what's that word? Vague? And you can have fatigue from anything, right? You can be fatigued because you haven't been taking your meds, or there's something else going on with you, okay? Breast tenderness. Well, if you're a female and you're like me who has periods, your breast can feel pretty tender. But again, the breast tenderness doesn't exactly rule out pregnancy, but that may happen, right? And quickening, fetal movement. They feel it. They could feel it, but it could mean, but when it's subjective, it could mean anything, and we're not definitely seeing it. So, which is why it would be presumptive, because it could be probably gas. Maybe it is fetal. We don't know, because the woman's the one feeling it. And then you have probable. So this is what the provider or the nurse sees, and it could possibly suggest pregnancy. So positive pregnant tests. There's false. There can be false positives. It happens, but it probably means the person's pregnant. They do sell pregnancy stores at drug tests, and it could be faulty. You never know. But that's why you want to have different opinions sometimes, right? Then enlarged abdomen. Well, true. When a woman's pregnant, they could have enlarged abdomen, but it could happen for different reasons. Braxton Hicks. So that could occur, but again, that doesn't exactly rule out pregnancy. It could happen, right? Oh, sorry. Goodell sign. So that's when the cervix softens. So that's a possible, probable, but it could be caused by something else too, right? Chadwick sign, bluish discoloration of the cervix and vagina, but women's hormones can be different. So yes, it could possibly mean the woman's pregnant, but it could mean something else too. Then you have the Hagar sign, the softening of the lower segment of the uterine. So, okay, so that's that. Then one more thing, you have the positive, which I was just saying. It definitely confirms pregnancy. There's no ifs, ands, or buts, okay? The woman is definitely pregnant, so so you can't argue with science. So fetal heart tones, and that's something the provider's going to hear, because he places a special, amazing stethoscope, and they can hear the fetus heart tones. It's there. Ultrasound of fetus. You can see the baby on a sonogram. It's there. It's kicking. And the examiner can feel it. So then it's not just a woman like saying, oh, I might feel. No, the provider or examiner felt the movements. There's a baby inside. Okay, so there's a difference. There's 3 differences. I know I used to mess up between the presumptive and the probable. What I was studying, I'm like, I don't know. But now it's like, it was like, aha, I got it, I understand. So I hope that helps out. The next video, so next Monday will be me going over the GetPal, and that's something, again, you have to understand, I had a difficult time, but I'm kind of understanding it, and I'm basically your online tutor, so we can learn together with this topic. So I'll go over that, and I will also leave links for this video. I think, I almost want to do simple nursing, but I think I'll just leave it to registered RN. She's very good, and Level Up RN too does a pretty good job, decent job on it. So this Wednesday, I will do a random short, probably on AAA versus CA, and there's two big obvious differences, and that's more so med-surg, but I'm just going to leave that as a short. And then Friday, I'm just going to talk about something different, and I will watch Ultimatum, I promise, okay? Have a good one, and enjoy the rest of your day.